Sepsis is a serious medical condition. Sepsis is triggered by an infection. Any infection, anywhere in the body, can potentially lead to sepsis. Some common infections that can cause sepsis include pneumonia, urinary tract infections, and skin infections. Pneumonia is an infection of the lungs. It can be caused by bacteria, viruses, or fungi. UTIs are infections of the urinary tract, including the bladder and kidneys. Skin infections occur when bacteria enter the body through cuts, wounds, or insect bites. Certain groups of people are at higher risk of developing sepsis. These include infants, the elderly, people with weakened immune systems, and those with chronic illnesses. The symptoms of sepsis can be subtle and easily mistaken for other conditions. This makes it even more important to be vigilant. Common symptoms of sepsis include fever, chills, rapid heart rate, and rapid breathing. You may also experience confusion, disorientation, and extreme pain or discomfort. Changes in skin color, such as paleness or clamminess, can also be warning signs. Diagnosing sepsis quickly is crucial for effective treatment. Doctors use a combination of tests to diagnose sepsis and determine its severity. Blood tests are essential to look for signs of infection, organ damage, and clotting problems. Imaging tests such as X-rays, Connecticut scans, or ultrasounds may be ordered to identify the source of the infection. Cultures of blood, urine, or other body fluids can help identify the specific bacteria causing the infection. Treatment: a multifaceted approach. Treating sepsis requires a multi-pronged approach to address both the infection and the body's response. Antibiotics are the cornerstone of sepsis treatment. They are given intravenously to fight the underlying infection. Intravenous fluids are also essential to maintain blood pressure and support organ function. Medications may be given to regulate blood pressure, improve heart function, and manage other complications. In severe cases, oxygen therapy or mechanical ventilation may be necessary to assist with breathing. Surgery may be required to drain abscesses, remove infected tissue, or address the source of the infection. Prevention: your best defense. While sepsis can be life-threatening, there are steps you can take to reduce your risk. Good hygiene practices are essential in preventing infections that can lead to sepsis. Wash your hands frequently with soap and water, especially after using the restroom and before handling food. Keep cuts and wounds clean and covered to prevent infection. Vaccinations are another crucial preventive measure. Get vaccinated against common infections that can lead to sepsis, such as pneumonia and influenza. Maintaining a healthy lifestyle by eating a balanced diet, exercising regularly, and getting enough sleep can also strengthen your immune system. The road to recovery. Recovering from sepsis can be a long and challenging journey. The body needs time to heal from the infection and the damage it may have caused. Rehabilitation may be necessary to regain strength, mobility, and cognitive function. Physical therapy, occupational therapy, and speech therapy can all play a role in the recovery process. Mental health support is also crucial after a sepsis diagnosis. Post-traumatic stress disorder, anxiety, and depression are common among sepsis survivors. Regular follow-up appointments with healthcare providers are essential to monitor recovery, address any complications, and ensure long-term well-being.